Good day, everyone, and welcome to the SuperTalk videocast. We're here to have a follow-up conversation. In a previous segment, we talked about the coronavirus with our Director of Nursing and Health Services, Adalia Del Bosque, and we're here to give our community an update with regard to the latest and what we've learned about the coronavirus. I do want to let the community know that as a district, we're being very proactive as we keep our facilities clean. We're still using our Gold Shield, which is the antimicrobial agent that we're spraying on our surfaces, and our schools are on a schedule. We're still sanitizing our buses in the mornings and afternoons. And we're working hard to change habits with regard to all the things that people need to do in regard to covering their cough and making sure that they're washing their hands appropriately and doing all the things necessary with regard to staying home if they're sick, or making sure that people understand that in order to avoid transmitting any type of disease, that we all need to work together in changing habits. And I think we're doing a better job, not only as a school district, but as a community. So Adalia, welcome, and talk to us. What have you learned as of late with regard to the coronavirus?
As school nurses, we are still aggressively doing prevention teaching on hand washing. Is one of the best ways to protect yourself and your family from getting sick. 5 simple steps that you can follow when you're washing your hands. Make sure you wet your hands, lather, scrub, and dry.
Very good. I know that we're also training our students to make sure that they cover their cough and cover their sneeze, and we're doing a better job of making sure that kids stay home if they're not feeling well, and parents are cooperating with that. And I know that all the parents are concerned with regard to things and steps that we're taking as a district. What are some steps that our nurses are taking with regard to just preventive measures?
We have registered nurses at every campus, so I want to assure everyone that we are working aggressively, making sure that we're monitoring the situation. We are going into the classrooms to do classroom teaching on prevention measures, which are very, very simple to follow, as you had said, Dr. Gonzalez. Just wash your hands.
And one reason we wanted to come back is when we first had our segment, the first Super Talk around the coronavirus, we had one confirmed case in San Antonio. So here we are a couple of weeks later, and as of today, I was researching the Texas Department of Health Services, and we now have 21 confirmed cases in Texas, none in Hidalgo County, none in our area. We don't have any confirmed cases, but there are 21 cases that we have confirmed in Texas. So I did want to let the community know that we want to make sure that we work as a team, because we talk about the fact that we're using an antimicrobial agent, Gold Shield, to keep our schools sanitized. And we're doing that on a schedule, and we're sanitizing our buses in the morning and afternoon. But we have to work as a team to make sure that our parents are coaching their children to do all the things that we talked about with regard to washing hands appropriately and often, covering their cough, staying away from sick individuals, and staying home if they are sick. So to the community members, I just wanted to emphasize the fact that we need to work as a team to change those behaviors, and know that as a school district, we're doing everything that we can to keep our buildings and buses sanitized, along with the food service department, who's doing a good job keeping things sanitized as always. But what's the latest with regard to Hidalgo County? What have you heard from our leaders in this particular area?
I continually work with the Hidalgo County health authorities. This is something that I do either daily, if not twice a day, sometimes 3 times a day. This is just a great way of teamwork that we have, and the partnership that we have with the Hidalgo County Health Department. I mean, it's just a phenomenal partnership that we have. And it's true, Dr. Gonzalez, we have to work as a team.
I know that from a district standpoint, we are also looking at what we can do to prevent the spread of any sort of disease. I know we had a breakout of flu, and we've done a good job with regard to turning that trend. And looking at the coronavirus, I know that I was researching and seeing that some universities have created a distance learning model. I know the latest one that I saw was MIT, and keeping their students home for the spring semester and doing distance learning. And I did want the community to know that we are working with the instructional services department, and we do have a plan in the event that we do get to that point. And I want to emphasize we're not at that point yet. But should we get to a point where we needed to use a distance learning approach, K through 12, we are working on that right now, and we do feel confident that we would be able to provide the best quality instruction in that particular arena. And I know that the community would definitely participate with us in that endeavor, but it would take a team approach to do that. It would require students do their schoolwork from home and submit it, and we would be grading from a distance standpoint. And that's something that a measure that we're not going to exercise yet, obviously, But I did want the community to know that we're having that conversation and we are prepared for a distance learning model should we get to that point in the future. Jake, if somebody wanted to learn more about the current state of the coronavirus in our area, where could they go to find more information?
Well, at the national level, they can go to the CDC, which is the Centers for Disease Control and Prevention, and that one is cdc.gov. At the state level, you can go to Texas Health and Human Services, and their website is dshs.texas.gov. And then at the local level, we can go to hidalgocounty.us, and they have the information on the current status of coronavirus in our area.
So to the community, we're continuing to be proactive. We're continuing to sanitize our buildings and our buses. And from a food service standpoint, we're making sure that we're doing all we can to use this antimicrobial agent that is very effective against single-celled organisms or bacteria and also viruses. So we feel confident that we're doing that. But nonetheless, we need to change behaviors and habits with regard to consistently washing hands and coaching our children and coaching ourselves not to touch our face, to avoid touching our mouth, our nose, our ears, because that's where a lot of the transmission comes from, to stay home if you're sick, to avoid contact with anyone that's showing signs of being sick, and to communicate and keep the channels of communication open with all these centers that Jake just mentioned, should you have information that you believe is important to our area.
I do want to share, Dr. Gonzalez, that they can also call a local number for additional questions regarding the situation. The number at Hidalgo County Health Department is 383-6221, and they will direct them to the appropriate person so that they can ask just questions that they're concerned about.
And I would like to take this opportunity to thank our board is being very proactive in this measure. So the McAllen ISD Board of Trustees, all Hidalgo County, you can already see a lot of teamwork taking place between the cities and the county and our school districts. So to all our elected officials that are going above and beyond, even at the state level, I know that our state reps are working very hard to make sure that we all stay abreast of current changes and that we are going to work as a team to ensure that we get through this. And once again, in Hidalgo County, in our region, there are no confirmed cases at this point, but we are being very proactive as we move forward as a district.